Vanessa Sivadge is with us now. And Vanessa, welcome to the program.
Thank you so much for having me.
Thank you. Now, Vanessa, I don't know what I can ask you, what I can't ask you, because you're involved in legal action now. So I just want to hear your story that brought you into the position where the government's now looking at you.
Absolutely. Well, the story really starts in 2021. I accepted a new position in a pediatric multi-specialty clinic at Texas Children's Hospital. And, at first, my background is in cardiology. And so I was helping babies born with congenital heart anomalies. And through a series of medical interventions and surgeries, we're saving their life. However, and I just contrast that with the endocrine clinic where I started seeing perfectly healthy patients and teenagers with functional anatomy, and we were harming them. The hospital was turning them into a patient dependent on the medical system for life through puberty blockers and cross-sex hormones. And so I started to see this rise in transgender patients coming to clinic, and specifically in something I feel like we don't talk about enough, which is teenage girls who are confused about their sex. But not only are they confused about their sex, they're also suffering with depression, and many of them are autistic, and many of them are coming into the emergency room because they've tried to commit suicide and take their life. And it was just very clear that there's so much going on, and they're truly suffering with just a variety of issues. And that was really devastating to me.
So how did you get involved in blowing the whistle? Tell me that part. I know that a doctor who we talked to a couple of weeks ago, who is also under investigation himself now for blowing the whistle, Dr. Haim, he did an article. He was anonymously giving information anonymously to Christopher Rufo.
Correct.
And he blew the whistle. And when did you get involved?
Right. Well, it was May of 2023, and I had contemplated quitting on a number of occasions because, I was being asked to do things that were against my beliefs and my faith, and would come home crying to my husband because I couldn't fathom what was being done to these children. And it was in this time that I read Christopher Rufo's article with an anonymous whistleblower, who we now know is Dr. Eithan Haim. And, I knew I had to come forward to corroborate his account, to just affirm that everything that he was seeing was true, because I was also seeing it where I was working. And so that's when I came forward anonymously in May of last year and worked with Christopher Rufo and just provided a different perspective from an outpatient clinic nurse that, transgender patients were being seen, and it was true.
So when was the first inkling that someone knew who you were?
Yeah. Well, life went on as normal for a little bit, and I thought, I had done my part. I had come forward. I had helped expose what was being done in secret. I felt like that was a redemptive opportunity for me. And, it was the evening of July the 24th of last year when we were having dinner with friends in our home. We were laughing in the kitchen, and I think we were making burgers. And all of a sudden there's a knock on the door, and my husband goes to answer it, and he didn't come back right away. And I just thought, oh my goodness, maybe someone's selling something, and so I go out and to the front door, and at my front door are two federal agents who are asking to speak with me about issues at my work. And, I think in that moment I can say that time just stood still. And I couldn't believe it, what was happening. But they essentially said that I was a person of interest in an investigation where they were seeking to unmask the identity of this first whistleblower, who we now know is Dr. Haim. But of course, I had no idea who he was. And I listened as they talked about how he had broken HIPAA by releasing, patient confidential documents.
Which is
and I
not
referred
true.
to him, which is not true, absolutely. And I referred to him as a whistleblower, and they immediately corrected me, and they were like, no, he's not a whistleblower, he's a leaker, and he has broken HIPAA by releasing patient information to the public. And I knew that they were lying to me. Not only that, but then...
Wait. How did you know they were lying to you?
Because I had read Christopher Rufo's, his article, and there was absolutely no patient identifying information on those documents. Everything was blacked out and redacted, and I knew that. And so that's when I knew they were lying. And so anyway, they continued, and they said that they threatened me and said they promised they would make life difficult for me if I was trying to protect this quote-unquote leaker. They claimed that I was not safe at work. They claimed that someone had given my name to the FBI, and it was I felt very coerced and intimidated. And they, to seal the deal, they said that they wanted my help to expose Dr. Haim. And, I was never going to help them. There was not a scenario under the sun in which I was going to help them.
And you didn't have the information at the time anyway.
No, yeah, I had no idea who he was. This hospital has 20,000 plus employees. Like I did not know him. And so anyway, they acted as if they wanted to be my friends, but they said, of course, if you don't help us, we can't protect you. And so it was very terrifying for me. And they left, and I just remember looking at my husband in stunned disbelief and shock at what had just transpired. We were so scared, but we also knew that they had crossed a line, and we would not be intimidated into silence. So after that point, everything changed.
Did you have any moment at all? I mean, having the FBI come into your home and say those kinds of things and say, we're going to make life miserable for you if you don't help us. I mean, it feels like Stasi kind of stuff, quite honestly. Was there a second at all that you went, oh, I don't want to be this person. I don't want to be here. I don't want to be here.
No, absolutely not. Because, the hospital has a reputation of lying to the public. And I felt like I was helpless, and I was the only one who had these religious beliefs that motivate everything I do. And I felt like I could no longer be silent. I felt like I know that I'm not the only nurse in America who feels this way. I know that I'm not the only nurse who has seen illegal things happening in the workplace. And so I feel a sense of responsibility to bring to light what has been done behind closed doors.
I talked to a lot of people, and some in your situation, and I can hear it in your voice how nervous you are, or how frightened of the situation. You're not some zealot. You're just a woman trying to do the right thing. Can you talk to other nurses? Because, as you said, there are other nurses that see it, and you said see illegal things happening in the workplace. Can you talk directly to them and give them courage to speak out as well?
Yes, absolutely. I believe that the saying is true, that courage is contagious. It just takes one person. And the world is in desperate need of people who will stand for what is good and right and beautiful and true. And other nurses around the country must feel like they can come forward if they are seeing something illegal happening at their workplace. Do no harm has to mean something. Medical professionals, whether it's nurses or others, they just I want them to feel a sense of responsibility to tell the truth about what they are seeing, and that's regardless of the outcome. And so, regardless of the consequences, because the truth is always worth it. So I want for others to feel emboldened and to feel empowered to protect children from irreversible damage and lifelong regret, because ultimately it's their lives and their well-being that are at stake.
When you say you saw crimes being committed, you're talking about Medicaid fraud, and how was that done?
Yes. I started noting some discrepancies in the paperwork, some red flags that were very concerning. For one, I saw that the hospital was using Medicaid to pay for transgender treatment. And this is Medicaid fraud, plain and simple. The Texas Medicaid policy, which is, available online, just clearly states that any medications or surgeries related to gender affirming care are not covered. And so, in essence, I saw a healthy teenage boy who was being prescribed estrogen to feminize his facial features and sexual characteristics. And likewise, a healthy teenage girl was receiving testosterone to masculinize her facial features and sexual characteristics. And in both of these examples, the insurance listed on file was Medicaid. So it wasn't like they were trying to conceal what was going on. This was easily, it was available. But not only that, the hospital, was using Medicaid to pay for transgender treatments, but on several instances, I noted that the patient was intentionally misdiagnosed for the purpose of justifying the prescription of cross-sex hormones. And that's even worse. So to justify the medical need for medications like estrogen and testosterone, the hospital was listing false diagnoses for these patients. So, for example, a biological male was said to have a diagnosis of estrogen deficiency. And this fraudulent diagnosis allowed providers to prescribe estrogen-based therapies to biological males in order to feminize their physical and sexual characteristics. And likewise with biological females. A female was said to have a testosterone deficiency, which is ludicrous. It's clinically incorrect. But that then justified the quote-unquote need to prescribe testosterone for a healthy female.
Vanessa, thank you. Thank you for standing up. Thank you for remembering who you are. Thank you for knowing who you serve.
Thank you.
God bless you.